Okay, so here we're gonna use a systematic approach. So we're gonna assume that the patient can bear weight and they can take the vibration that we're about to apply. I like to go on level 3 with the hypersphere, getting a lot more power, right? So we're gonna place down the bottom of the foot, okay? The vibration is going to increase blood circulation as well as activate the mechanoreceptors in the bottom of the foot. We're gonna ask the patient to come down. We're gonna put some pressure, go into plantar flexion here, and now she's gonna come back up. Okay. Now what this is gonna do is increase the blood circulation, increase nerve sensory patterns, which will increase the range of motion in our mortise joint and allow us to then progress through our systematic approach for an ankle sprain. Perfect. All right, now for the next step, we're gonna incorporate the hypersphere and the raptor. Put in the hypersphere, again, bottom of the foot. We already went over this step, and we're gonna fire up the raptor. We're gonna get that on our tibialis anterior, which controls dorsiflexion in our ankle, okay? So she's gonna bring her foot straight down, getting some active range of motion. Good, now we're gonna bring it back up. And bring it back down. Good, and back up. And bring it back down. Good, and back up. Good. It's another way that we incorporate AMP therapy powered by Hyperice to get ankle mobility and get that blood flow in that tibialis anterior, so we increase that range of motion. So when we go into non-weight bearing to weight bearing exercises, we get the proper range of motion, so we get this athlete back better, faster. All right, now for the next step, we're gonna incorporate the hypersphere and the raptor. Put in the hypersphere, again, bottom of the foot. We already went over this step, and we're gonna fire up the raptor. We're gonna get that on our tibialis anterior, which controls dorsiflexion in our ankle, okay? So she's gonna bring her foot straight down, getting some active range of motion. Good, now we're gonna bring it back up. Good. And bring it back down. Good, and back up. And bring it back down. Good, and back up. Good. Another way that we incorporate AMP therapy powered by Hyperice to get ankle mobility and get that blood flow in that tibialis anterior, so we increase that range of motion. So when we go into non-weight bearing to weight bearing exercises, we get the proper range of motion, so we get this athlete back better, faster. Now, the last step, so many times the swelling from the ankle sprain, okay, comes down to the posterior side, down here by the Achilles tendon, and that's where the swelling sits. We get some bruising, ecchymosis, non-tender on the backside here. So what that leads to is to decrease range of motion in our plantar flexion, as well as in our musculotendinous junction, where the Achilles and the gastroc meet. So what we do is we'll place the hypersphere right where that junction is, okay? Now here, we're gonna go from dorsi to plantar flexion, okay? Increasing that range of motion. But now we're gonna take it another step. We're gonna work on the distal fibers of the tibia anterior, create tension inferior to superior. We're gonna go dorsi to plantar flexion, increasing that range of motion in that ankle, and getting a lot more blood flow to the muscles we're about to work on. One more. All right, guys, so now for the next phase of care, using this technology and AMP therapy. Using the band for resistance, getting our hypersphere, placing the bottom of the foot, going from dorsiflexion, and then resisting with the band, going to plantar flexion, okay? Doing one more time, coming back up and coming back down. We recommend that you do this about 10 to 15 times. Then you move on, hypersphere, pin at the musculotendinous junction. Continue on with the exercises, dorsal to plantar flexion, increasing that mobility in that ankle. Finally finishing off, incorporating our Raptor. We're gonna be working at the tibia anterior, superior to inferior, bringing it back up, tractioning, pushing down, lengthening out that tissue. And back up, and down. Perfect, doing that again, 10 to 15 times, creating a systematic approach to getting you out of pain, increasing range of motion. Now we're gonna go to our weight bearing series.